Okay.
Yeah.
All right. Good morning, everyone. I am so excited to have my not my talk, but my good friend Mary's talk today. I've been thrilled about it since she agreed to do it a few months ago. So my name, for those of you who don't know me, my name is Melissa Tompkins Lewis, and I am the owner of South Coast Veterinary Management Solutions. And I am very, very excited to be able to bring webinars to other managers and other leaders and even other people that are not leaders in the hospital to help them learn new things. And I'm very excited to continue doing this. My webinars are on the second Thursday of every month at 10 a.m. Pacific Standard Time. If you can't attend live, they're always uploaded and put on my YouTube channel, which is at South Coast Veterinary Manage 263. And then you can go back and watch it later. I also send out the link to everybody who's registered. So you'll always have access to that. So I'm super thrilled now. I'm going to go ahead and give
Okay.
Mary the reins. I'm so sorry. I forgot. If you have questions for Mary, please throw them in the chat. She will answer them at the end. And for those of you who have attended live today, we'll also be able to receive a C certificate for your attendance. So, and then for Mary, I'm going to let her introduce herself, but I will say she doesn't know this, but when I first met Mary, I was scared of her because she was very serious. And I didn't know that I'm a cat ear weird person. I wear cat ears at conferences. And I didn't know that if she would appreciate that. And she was super nice and super friendly. And now I feel really great about my friendship with Mary. So anyway, so Mary, there you go. Please share whatever you want to about yourself. We would love to know.
I I am mortified that you were afraid of me. No, I come off with this resting, as I call it, my resting witch face. But normally I do like to have a lot of fun. So thank you for the nice introduction. I've been in the field for over 30 years now, and all of it's been in dentistry. And I've done a little bit of everything in dentistry from 13 years of research working with companies to help develop companion animal products and get them to market. I work with the Veterinary Oral Health Seal of Approval. I have did that for 13 straight years. My professor I worked with, who was not a veterinarian, wanted to go back to his first love of human dentistry, and I said, "Ew." But while I was working with him, I had gone back to school and gotten my veterinary technology degree as well as a laboratory animal degree, and was working on my VTF. So I went to practice for 7 years, a little over 7 years at a GP, and then 14 years ago, I decided to be absolutely insane and start my own training business. Never thought I would be as busy as I am, and literally. Yeah, some days it's like as soon as I'm done here, I'm driving to Southern Missouri to do a training tomorrow. So, kind of always on the run, but I love to do this. I am a textbook author, lecturer, speaker at many conferences, and my main job is going into hospitals and teaching their entire team proper dental techniques because we don't get a lot of it in school. Okay, so that's one of my true passions. But really, I love to help with people gaining compliance and how do I get that patient from the exam room to the table and how do I get them on board with doing home care as well. So today I'm going to see if my computer will actually work. That'll be a big plus. We're going to look and discuss the prevalence of periodontal disease, how to get your team on board. We're going to talk about educating the client about periodontal disease and then engage them to help get that client or the patient the care they need. So, in a perfect world, I do live in Kansas and I like to think that's God's country, but um, we would have 100% compliance on everything we would do, correct? I mean, that would be every patient we see would be on flea and tick control, on heartworm prevention, on everything, right? But we know that probably isn't realistic. And we know we're not going to get everybody to do everything we ask. Now, when it comes to dentistry, 100% compliance would mean preventive oral care, which is routine plaque removal. And by routine, I mean daily or at least every other day. Once a week isn't enough to do much good. Annual exams would happen, and we would have annual prophylaxis with pre and post visits with our clients. And this is one of the only times you'll really see me use the term prophylaxis when it comes to doing a dental cleaning for our patients, because most of the time we're actually treating disease. Very rarely are we preventing something. We go to the dentist every 6 months for preventative uh, care, which is, the prophylaxis. But unfortunately, many times we're actually treating disease with our patients. I want to go to a world where we stop doing that and we're doing prevention to keep our patients' mouths healthier. So I want you to kind of think about this. I know I don't have a lot of people on, but if you have the ability to enter into the chat why you think compliance is so hard, I'll, see what we come up with, and then we'll move forward. And if you're driving, Brittany, please do not hurt yourself trying to do this. I don't want you to get in trouble. Cost is one. I hear that a lot. Anything else? And if you don't get it, cost and time. Fear of anesthesia, good one, Sandy. All right. Well, I'll give you a few more minutes or a few more seconds, but I'm going to kind of start this. And what the results I'm going to give you, I think are going to surprise a few of you because this is, you know, this is actually from a focus group. So it's not just me coming up with these things. Okay. And this is actually from a focus group asking why compliance was so hard. And the first number one reason people gave us is they just didn't hear us. And if you think about the fact that last time you went to your own family doctor and you were just having a checkup, and we retain about 20% of what they tell us at our doctor's office. And when we're looking at thinking about our pet being in the exam room, we're probably slightly stressed out because maybe they're not behaving themselves or, whatever, we're worried about them. And possibly we have family members with us and, we're only retaining a little bit. And part of it too is the words we use in veterinary medicine don't always mean anything to our pet owners. So we're going to talk about changing those as we go through this presentation. The number two reason is they just didn't understand how important it was. I can't tell you how many times I've heard, well, I've owned dogs for 50 years and I've never worried about their teeth before, so why should I start now? And we really have to explain to them that A, we need more, we know more now, and we also, pets are living longer. So, and that we can actually get 2 to 3 more years of life out of a lot of our pets if we can keep their mouth healthy. So we need to make sure people really understand that this is an important procedure. Maybe we didn't follow up. Maybe they were thinking about it, they were on that cusp, and they wanted to go forward with it, but we didn't do our job to say, hey, you know what? We talked about this last week, and I would love to have you, see if we can go ahead and get you scheduled for a dental procedure. And we want to make sure that, the that we're following up with them so that that doesn't drop off the radar. You're right. Fear of anesthesia. Everybody knows somebody's mother's brother's uncle's dog who died under anesthesia, right? And it is scary. But we have to do a very good job in our hospitals explaining what we do at XYZ hospital to make sure that your pet is going to be as safe as possible under anesthesia. And that's going to be pre-surgical blood work, dedicated anesthetist, all of those things to really, make sure that their pet is as safe as possible under anesthesia. But only 7% said it was about the money. And everybody, that's the first thing I hear when I ask this question. And yes, it is expensive. I'm not going to lie. Some of the prices I've heard across the country lately has made me take a gasp, like, oh my God. But if they understand the value and why it is so important and how much it can help their pet, that cost actually becomes less of a concern. Okay. Now, I'm a big believer in offering third-party payment plans for our pet owners to help them with these kinds of things because it is a nice little chunk of change. We want to make sure that we're helping them understand it. But most of the time, we as veterinary professionals, we don't make a lot of money. I don't know if I've surprised anybody out there by that, but we don't make a lot of money. So a lot of stuff to us is like, ooh, that's really expensive. But we have to realize we can't put that spin on it when we're talking to our pet owners. So a lot of times we just assume it's the money, and sometimes it's just they don't understand the reason or the value. Now we know there's roadblocks too, because back when I went to tech school, I got a whole hour of dentistry, 1 hour. All right. And my instructor actually asked me if I wanted to teach it. And I now teach 2 full semesters at 2 tech programs, distance programs on dentistry. So, and a couple of the programs, if it's a 4-year program, actually has 2 semesters of dentistry. So rock on, right? But they don't get a lot of it in vet schools yet, even though it is a core requirement by this Committee on Education from the AVMA. It still is really hard to get that across to vet schools that this is something that's so important to teach. We teach them stuff that very few animals are going to deal with, but something that the majority of our pets have, we just don't talk about. And it's really sad. And I'm hoping the day comes when that doesn't happen anymore. So I'm going to ask you guys again, if you can contribute to the chat, but what percent of adult dogs and cats do you think have some degree of perio disease? Okay, I see 80%, 80, 70, 60. Okay. I'm going to tell you right now, according to this statistics I have at the moment, the books say 80% on animals over 2 years of age. Dogs and cats have some degree of perio. Now, having just listened to a diplomate speak on Monday night and my own experience and talking with other diplomates, we feel it's closer to 90%. That means 9 out of every 10 animals that walk into your hospital have some degree of dental disease. Okay, now that can just be gingivitis, which is stage 1. Okay, so maybe they just got some red swollen gums. Maybe they bleed when they chew on a toy, but they don't have any bone loss or anything. But that is still periodontal disease, and that can be treated. And we have to do a better job to treat those 80%. One of the worst statistics I've seen in a long time, though, is the fact that only about 14% of dogs receive veterinary care at a veterinary hospital or dental care at a veterinary hospital, which to me is really sad. Even if it's 88 or 80%, that means we're missing the boat on 66% of our patients. And a lot of times it comes down to the veterinarian isn't comfortable with it because they never learned about it, or they are going like, well, it's not that bad. We can wait and see. We're going to kind of watch it and see what happens. And instead, they're just letting a disease get worse instead of treating it immediately or even being preventative. But how can we improve this? And I think one of the best ways we can improve that statistic is that we talk about it at every examination, no matter what the pet presents for. Let's look at those teeth and start talking about them. I don't care if they come in for a laceration, if they come in for just a vaccine update, or whatever they're presenting for. I even joke with my emergency critical care people that, I don't care if they come in by hit by car, look at those teeth. And I know they kind of laugh at me at that, but I'm like, well, you got to look at the CRT and the mucous membranes, and the teeth are right there, guys. Take a look. But if we look at the tooth every time the mouth, every time that patient presents, they're going to start thinking, my gosh, every time I come in here, they're looking at this oral cavity. It must be pretty important. Okay. So the more we start looking at it, the more we start talking about it, the more we're going to be able to do and having our pet owners understand the vital importance of having good oral care. So what is periodontal disease? Well, it is an inflammation that begins with the tissue surrounding the teeth. It is the most common, by far, way above anything else, the most common disease that occurs in dogs and cats. No other disease has 8 to 9 or, out of every 10 animals having it. Okay, nothing else even remotely comes close. But it is one of the top 3 concerns of pet owners. And you may think, come on, Mary, that's not true. How can that be? We can't get them to get a dental cleaning. How can it be important? But how many times has your team been in the exam room and getting a history on a patient? And you kind of say, okay, do you have any other concerns? And they say, yeah, their breath is atrocious. That is probably a dental disease. And I will tell you, it is probably about 95% of the time or more a dental issue, more so than being a gastric issue. Because when we have dental disease, we have some things that are down in those pockets that are black pigmenting, gram-negative bacteria that often put off volatile sulfur compounds, which is what gives it that stinky breath. So they may not realize they're worried about dentistry, but it is one of the problems that they're dealing with. And then calculus and gingivitis are 2 of the most commonly diagnosed conditions by veterinarians. And this is from AHA. Every time a veterinarian writes down on the dental chart after an exam that there was calculus or gingivitis present, that's a diagnosis. Unfortunately, too many times we're not acting on it. We're always like, well, we can wait and see. I was brought into my hospital to build the dental practice, to find out why, to build it up. I couldn't get my doctors to recommend a dental procedure till we were at a stage 3. And I'm like, come on, let's get them in at 1 and 2, and then we can prevent them and we don't have to go to stage 3 or 4. So it is something that we have to be better about. So another definition for periodontal disease is periodontitis. Also, it's an infectious disease caused by plaque and the resulting inflammatory response. So there's a couple terms there I really want you to center on. And one, it's infectious disease. It's an infection. No two ways around it. We've got bacteria, we have a wound. It is now an infection. Okay. But it's caused by plaque, not the calculus, not the tartar on the teeth, which unfortunately, too many veterinary professionals try to get hung up on how much calculus or tartar is on the teeth. I could care less because calculus and tartar, or calculus, is basically calcified plaque and it's inert. It doesn't cause any disease by itself, but it gives more surface area for more plaque. And plaque is what has the bacteria and the bacterial byproducts that lead to periodontal disease. So if you're talking to your veterinarians, I would encourage them to stop looking at the amount of calculus on the teeth. Look at the gingiva. What does the gum tissue look like? That's what's going to tell me what degree of disease I have. They can have calculus this thick on their teeth. I could care less. I can pop that off. What does the gum tissue look like? We also have to remind everybody that the iceberg effect of a tooth, we only see about a third of the tooth. Two-thirds of it's in their head. So we're not seeing most of what's happening. And we have to remember that if we are only cleaning the crowns of the teeth at our hospital, don't even sedate the patient, guys. You're not doing that pet any good. We had a presentation at the dental forum a number of years ago, and it was kind of comparing two patients, and we had to determine which one was seen every 6 months for a dental cleaning at a hospital, and which one went to an anesthesia-free dentistry. Both were submitted or recommended to the specialist for an extraction. He shared all the x-rays, he shared everything with us. Both dogs left without a single tooth in their head. Okay, not kidding. But because there was no bone left, the gums look good, or the tissue looked, not the tissue, the teeth looked good. They were nice and white, but neither one of them were able to, or had ever cleaned below the gum line. Okay. So the moral of the story is yes, anesthesia-free dentistry is bad, just okay. But if you are at a hospital and you're not cleaning below the gum line, they didn't do anything for that patient that had its teeth cleaned every 6 months. Okay. Because below the gum line is where the disease is at, and we have to be very, very effective. And if you have anything to do with mouths, you know that iceberg there is kind of like a maxillary fourth premolar. So I just have to keep it in here. All right. So when plaque grows onto the crown of the tooth, it is a gram-positive bacteria. Okay. And it grows upward onto the crown, but it also goes below the gum line, like I mentioned. As it goes below the gum line, the type of bacteria that's present changes. So it goes from being anaerobic, which means it needs air, or excuse me, aerobic, which means it is air, to anaerobic type of bacteria. And these anaerobic gram-negative bacteria are also become plaque pigmenting bacteria. And these guys are the bad guys. They're the ones that cause a lot of, release inflammatory mediators and cytokines. But what happens is the body wants to heal this. So the body is sending in neutrophils to come and macrophage and eat all the bacteria. Well, pretty soon they're overwhelmed. And what happens is when those neutrophils become overwhelmed, they release proteolytic enzymes and start destroying the periodontium. The periodontium is the gingiva, the alveolar bone, the cementum, and the periodontal ligament. So they start destroying all of that. Now there's consequences to PD too. And I can't imagine you've probably been around in veterinary medicine too long if you haven't seen some of these things. But we can get a pathological fracture. That's a Yorkie who jumps off the couch and barely knocks his chin on the floor and fractures his jaw, starts screaming because his jaw is broken now because he had so much bone loss. We get periocular damage from an abscess that can cause the eye to have issues. We get oral nasal fistulas, which is direct communication from the oral cavity to the sinuses. We get bone infection and we get tooth loss. But what we have to make sure our pet owners know is that every time that animal is eating with a mouth much like the one I have in the image there is blood. And that blood is getting in, and all that bacteria is getting into their bloodstream, and it's going through their kidney, their liver, and their heart. Okay, so it's very unusual to see. I always kind of joke about this, but if you've ever had a 12-year-old toy poodle in your hospital with renal failure, have they ever had a pristine oral cavity? Okay. Yeah, and if you ever find one of those, please take a picture and send it to me because it's actually a unicorn. They just don't exist in nature. Okay. But these things do have an effect on the overall body's well-being. One of the things too is that that mouth that we see here is not comfortable. That patient isn't feeling good. They may not show their pet owners, or I hear a lot of times, well, he's like 5 now and he's slowing down. I'm like, he's not old. 5 isn't old. But because his mouth hurts or he's feeling that constant barrage of infection, he's not feeling good. But if we clean that mouth up, you call them back 2, 3 days later to check on that patient, like, oh my God, they're a puppy again, because they don't have all that chronic inflammation and infection happening. So just looking at, the stages of disease and how it works, we have 4 stages. And I use these stages in my hospital for a couple different things. I used them for pricing. Okay. I had a different price for stage 1, 2, 3, 4. Okay. And it included basically everything from IV catheter, pre-exam blood work, x-rays, the cleaning and scaling, all of that stuff, and extractions or pain, medications were extra. Now, the trick is to keep stage 1 and 2 as low as your hospital can go, okay, to encourage people to come in. Obviously, it's going to be much more expensive for me to do a stage 4 than it is a stage 1 because of time. So not only did I use this for pricing, but I also used it for scheduling. So we never scheduled under an hour. So stage 1 was an hour. Stage 2 is an hour and a half. Stage 3, we went to 2 hours, and then we cut it off at 3 hours at stage 4. And that way we weren't killing ourselves at our hospital, and our receptionists were trained that if we gave an estimate for or a treatment plan for a stage 3, they're going to put 2 hours on the books for us. And I knew I was in trouble with my CSRs when I had 4 stage 4s in a day. And I'm like, I don't know what I did to you. I apologize, but we're going to have a come to Jesus meeting because this is not happening again because I was dying and back, right? Um, but we want to make sure that we are doing appropriate. I can do 4 grade 1s in a day without even blinking. Okay. But what's really important though to remember is there's kind of a line in the sand here that even me as a technician can cure stage 1. I can get in and clean that mouth up. Stage 1 is only gingivitis. We have no bone loss. I can clean that up, get that pet owner on good home care, and we can take a stage 1 back to stage 0. However, once I have bone loss, I can no longer stop it. Okay. I can't reverse it anyway. I can stop it, but I can't reverse it. Or I may just slow down the progression because periodontal disease is a progressive disease as well. But we can stop it from progressing with good home care. Okay. So I use this chart a couple different times. If anybody wants a copy of it, you're welcome to reach out to me. I'm happy to share that with you because I think this is something that really helps our pet owners kind of see what we're dealing with and what to look at it. But we have to change the words we use. And I know that I hear it all the time. I'm on too many Facebook pages for dentistry. And I'm like, well, we had a dental in today. Or, I'm going to do this dental on this patient. And I'm like, okay, first of all, let's get rid of that word because it's an adjective. It's not a noun. It's not a procedure. And we say that to our pet owners and they look at us like, well, what is that? Um, I tell people, call your dentist and schedule your next dental. And they're going to ask you dental what? Because it's not a word we use in human medicine. And, we have dental models, we have dental instruments, we have dental x-ray units, but it's not a procedure. So I try and try and try. I always say I'll retire when that word is eradicated from the veterinary jargon, but I've got a feeling I'll be here for the next 200 years because it'll never happen. But try to get your hospitals to stop using that, especially when they're talking to the pet owners. But if they say it in back, they're going to let it slip to the client. Does it occasionally slip out of my mouth? Yeah. Okay. It still does. But I do my best and I kind of smack myself up when I do that because I'm like, you know better. Okay. So we need to use words that mean something to the pet owner. My favorite is COHAT, Comprehensive Oral Health Assessment and Treatment. Yeah, it's a mouthful, but it is really explaining what we're doing. It's a comprehensive oral health assessment. Okay, we're taking rads, we're doing charting, we're looking at the mouth, and then we're going to treat what we find. Okay. You could shorten that to OAT, oral assessment and treatment. Back in my day, we didn't have those two terms, so we were using periodontal therapy. Nobody knew periodontal, but they knew therapy meant treatment, or even just professional dental cleaning and treatment. A lot of diplomates I work with would like me to add somewhere in there anesthetized dental cleaning and treatment because we really want to make sure that term anesthetized is in there as well to kind of help understand why those non-anesthesia dentistries are so, don't even get me started. We only have an hour. Okay. But yeah, get to the point where we change. In fact, when I teach my classes the first week, I tell them if I see them use the word dentals as a noun or as a noun in a assignment, I'm going to count points off. So I want them to get now, starting as students, to not use that term anymore. I also use the word pain and infection. So if I took off all the gingival tissue off a Labrador retriever, I would have the size of the palm of my hand. Okay. Now, can you imagine a pet owner not demanding treatment with an infection this big anywhere else on their body or the pet's body? They're going to demand treatment. But because it's underneath the oral cavity or underneath the lips, we aren't talking about it. Okay. And it is painful. Yeah, there's some people who tell you, oh, it's really not painful. But how many times does that patient say, oh my God, I feel so much, they're like a puppy again? They may not be painful, but they sure don't feel good. And another thing I'm going to do when I do get ready to retire, which hopefully isn't a lot of years away yet, but I'm going to write a talk and I'm going to put it everywhere I can. And it's going to be, we need to stop shooting all over ourselves in vet medicine. And we do that. We never want to give a definitive recommendation to a pet owner. Okay, we never want to make them mad. We always want to say, you really should consider having your pet's teeth cleaned. You really should consider doing this. And when we say should, it's like, maybe, maybe not. And I actually had somebody in an airport of all places, because usually when I'm flying, I try not to wear any apparel because I sell shoes when I fly, because otherwise you hear way too many stories. But this woman, I hadn't changed, and she goes, yeah, why is it that my vet will not tell me that my 13-year-old Chihuahua needs his teeth cleaned? And I looked at her and said, your 13-year-old Chihuahua needs his teeth cleaned. Okay, because I'm like 13-year-old Chihuahua, that is a dead giveaway. And she goes, yeah, they always kind of hem and haw around it, but they never really come out and say it. And I'm like, oh my God, can I use you as my poster child? Because you're exactly what I talk about. And we found out we actually, she's from a neighboring town. Um, and I'm like, you need to call your vet and tell him you need to get in. And where do you go, by the way, first? And she did tell me that. And I said, okay, I trained him there. Just tell him I sent you and you need to have this dog's teeth cleaned up. And she was so appreciative because now somebody gave her something definitive that she could do to help her pet. Now, another little thing, and it's just a mind game a little bit, but I'm okay with some mind games, is that we give them a prescription versus a recommendation for a dental cleaning. And I know it's just a little bit of a term and they're not going to go get it filled at Walgreens, but if on your treatment plan for dental treatment or dental procedures, you put prescription for dental cleaning. And just the term prescription does help that pet owner realize that this is something that's pretty important. Okay, so let's go ahead and get this done because that turnaround from recommendation to prescription does make a difference in our pet owner's mind. One of the things I like to just talk about, and I don't have one on my table right or my desk right now, is something called Strip. And this is a test that every hospital can order. It is costs $4 a test, and it is a little tiny strip that you have your technicians can do this. You don't need the doctor to do this. And it's done in the exam room in front of the pet owner. So it's none of this, what are you doing in back? You know, what kind of magic did you do in back to make my dog have disease that didn't have it beforehand? But it is a little tiny test strip, and I do have one here. I don't know if you can see it. I guess not because I've got my blur on. But it is just a little strip, and what you do is you hold this kind of with your finger, and you just gently wipe it along the maxillary arcades of the dog or cat's maxillary teeth. And you're going to be picking up what we call like the saliva and the curvicular fluid. And what this test strip does is it detects thiols. And thiols, remember when I talked about periodontal disease and those black pigmenting bacteria, thiols is one of those volatile sulfur compounds that they put off. And this can find a pocket that we couldn't see. Okay, I've seen it happen more than once where I'm like, oh wow, this mouth looks pretty good. Let me run the test. And whoa, we got stuff going on here. And what happens is on this little test strip, there's a pad. And if that pad has any amount of yellow change to it at all, because it's white, and if there's yellow on it, that means there is a pocket with ana or the black pigmenting bacteria somewhere in the oral cavity. It is a force, I call this the $4 and 10-second test. Having one of these little tubes that come with 40 of them in your exam rooms, run that. People who use this and incorporated this into every wellness visit have increased their dental revenue by over 24%. Because now here's a test that telling me you have something going on versus me just kind of saying, hey, I think you need your dog's teeth clean. It is something that does make a difference. It detects those thiols early on. And like I said, it's $4 a test. I don't believe in raising the cost of my exam for that test because I know I'm going to make up the difference in how many more dental procedures I do. Okay, but every wellness visit, it makes a huge difference for getting that across that something's happening in that mouth. But we have to believe it. Veterinarians and technicians have to educate those clients about the importance of dentistry. And we know that you guys are all practice managers. I'm assuming that about 25% of our clients will do anything we recommend without even question. We have that 80-20% rule in veterinary medicine that 20% of our clients bring us 80% of our revenue, and we all know who they are. I still remember who mine were, 14 years ago. 60% are probably going to do it, but they need to think about it. Maybe they need to apply for a payment plan or they need to save money. They need to talk to their significant other, but they're probably going to go forward with the procedure. The ones that hurt my heart are the 15% that are just never going to do anything. They want just that rabies shot, doc. I don't even want an exam. I'll just go to the feed store and buy my own rabies vaccine if I could and do it myself. Those are the ones that kind of hurt me. But we know that companion animals are part of the family now. I grew up on a dairy farm, a guy, we had dogs, okay? And they did not get into the house. Heaven forbid we had a dog or cat come into the house. My mom had a conniption fit. But now every one of us kids have dogs, okay? Every one of us have dogs or cats in our house. Um, and they're part of the family. In fact, my boys will tell you, my two kids will tell you that Gypsy, my little dog now, is the child we love, because she goes everywhere with us and we, take care of her all the time. But that bond is important for the veterinarian and their team to understand that clients do want what's in the best interest for their pets. They just may not know what it is. And it's essential that everybody is motivated. Now, you don't have to be the dental diva. That's my nickname in the field. But you have to be excited by it. You have to be motivated and you do have to project enthusiasm because if I just kind of go, oh God, Dr. So-and-so wants me to talk to you about dentistry again, they're not going to get excited. Okay. But we have to have a little bit of enthusiasm to get our clients on board. We have to have the whole team, though. The entire team has to be on board. And that means receptionists, CSRs, whatever term you want to use, have to have a positive attitude, right? They're the first and last defense of our hospitals. If they don't agree with something we're recommending, the client asks them and they say, oh gosh, I'd never do that. You've lost that procedure, okay? Because they know more than we do, according to the clients, right? So have a positive attitude. Maybe give them a free dental cleaning so they can see that reaction in their own pet and see how much better it was afterwards. Also, give them the opportunity to work with phone shoppers. We had a script for our receptionist that was, we didn't give a price over the phone. We never did because we had 4 different prices. We didn't know what it was going to be, but we would ask the client or the potential client to come in and meet with one of our technicians, and they would take a look at the mouth and look at what's happening and give them an idea of what was going on. And then if they wanted to go further on with it, then the doctor came in to develop the VCPR. We probably converted, well, those were free appointments, guys. I know that's like, ooh, taboo, free. But we converted probably a good 80% of those to actual new clients because we took the time to talk to them. Okay. Now, also having a technician with an emphasis in dentistry, they don't have to be a VTS, but somebody who really loves teeth, they're going to do a lot of the client education, most of the procedures, keeping that equipment running, as well as keeping the supplies up to date, as well as staff education. Even if you have kenneled staff, if you're still doing, kenneling, have that that team member trained to lift the lip and then make a really gross face. Just kidding. But, get in there and like say, hey, you know what? I see a lot of debris on, Fluffy's teeth. Would you like one of our dental technicians to take a look at her while she's boarding? And maybe we could even, you know, take care of her mouth then, while they're boarding. And a lot of pet owners are like, yes, do it while I'm not around. It'd be great. Offer to brush their teeth. But one thing I plead with you is if they bring in a toy that is inappropriate, that's going to cause a fracture or potentially cause a fracture, don't give it to the dog while they're boarding. Okay. You do not want to be responsible for a fractured tooth. Even though that dog had that treat at home, that bone, then they chewed on it forever. If it broke while they were at your hospital, you're in trouble. So just don't do that. The veterinarian, they're the team leader, right? They should be encouraging their team to get the education they need to do a better job with talking to clients. But every patient, every time, I think it should be a vital assessment. And, talking to other technicians, we're like, gosh, pretty soon we're going to have 60 vital assessments. But yeah, it is something we need to look at every single time. It has to be part of the philosophy of our hospitals. And it should be as routine to talk about dentistry as it is to talk about vaccine protocols, heartworm prevention, flea and tick, because all of those things, including dentistry, prevents disease. We do not have to have an old dog die with no teeth. Okay. In fact, every one of my pets have gone into their teens. I had one who unfortunately didn't make it to 11, but she had an autoimmune issue. But she died at 11 with a grade 0 perfect mouth. My 7-year-old Jack Russell, who's sleeping over here, is 7 years old and still a grade 0. Okay. So they do not have to have bad teeth as they age. So it is possible for that Chihuahua to die with all their teeth in their head. It'd probably be a miracle, but it can happen. Okay. We do want that to be a possibility. But you got to believe in it. It has to be done at the right level. It can't be superficial. We can't just clean the crowns of the teeth. We can't not take radiographs. We have to make sure we're taking the time to train our team how to do it appropriately. The days of the 30-minute, 20-minute dental procedures are gone. Hopefully, the days of hospitals scheduling 18 to 14 to 18 dental procedures in one day are gone. They're not doing any justice to the animals by doing that unless they have multiple tables. But I've had people come up to me crying at conferences because what do I do when my arm is numb after 8 procedures? And I'm like, 8? Well, my doctor schedules 14 a day. And I'm like, well, I hate to break it to you, but you're really not doing those animals any justice because you aren't taking the time to look for what we need to do. We have to train our staff to do it appropriately. And this is something technicians can really drive. Um, um, I'm I know we got some Californians in here, so bear with me for this for just a second because I got to say this. I know California allows technicians to do extractions. I am against that. It is oral surgery. It is not there is never just an extraction. It is oral surgery. You're altering the body, and we are not allowed as technicians to alter the body. So I'm against technicians doing extractions. Yes, I know they sometimes do a better job than the veterinarian, but the veterinarian's getting paid for them. Make them earn their keep. Okay. And I don't do extractions as a technician. Have I ever taught a veterinarian to do one? No. I have taught a few vets over the years, but I also know how to spay a cat. Have I ever done it? No. Okay. So it is something to look at it like that. But you have to train your team how to do, because we can do everything else. We can do the charting, we can do the x-rays, we can do everything but diagnose and do surgery. Okay. And make a prognosis. But you also have to make sure it's not just done superficially. Take time to look for disease. Get those rads done. I think it's almost malpractice anymore for hospitals that don't have radiographs machines anymore because there's so much can happen below the gum line that we just can't see and the patient can't tell us about. You also have to have some trust and confidence, right? People trust us, and we really need to make sure that we keep their trust. So we have to project interest and confidence. We have to not get too busy. I know that can be hard, but when you walk into that exam room, that is the only person you're worried about right now is that client and that patient. Smile, shake your hands, introduce yourself, tell them what your credentials are. I'm a big believer in everybody wearing a name tag with what their credentials are and their role in the hospital. Because I can't tell sometimes when I go into a hospital to do a training, who's a vet, who's a tech, who's an assistant, who's a CSR. I have no clue. And I have gotten yelled at by vets because I assumed they were a technician. And I'm like, well, how am I supposed to know? Sorry. Make sure that you always acknowledge the pet. Make sure we keep that trust. If there's children present, don't tune them out. Parents will tune you out if you ignore the kids. Okay, so give them something to do. That's why on my website I do have free downloadable color pages for the kids. They're of course cute little dog and cats, but with teeth. But you can download those for free, give those to the kids, let them listen to the heart rate, all those kinds of things, but make eye contact. And one of the things I tell client or to tell technicians all the time is you might get tired of talking about this, and it might be the 10th time today you've talked teeth or you've talked heartworm prevention or whatever. But remember, it might be the first time that client's heard it. So always keep that in the back of your head that they may not have heard this before. I love this meme. This is my favorite. Sorry, it's blurry here, but yeah, Dental Health Month. Oh my goodness. I worked with Hills Pet Nutrition as a consultant when Dental Health Month started. It was Dental Health Awareness Month. It is still Dental Health Awareness Month. It is not Dental Discount Month. And somehow in our profession, we have made it a discount month because nobody knows how to talk teeth. So we're going to discount this procedure. But what we do is we've told our pet owners that dentistry is not important because we can afford to discount it. And that we know we charge too much for it, so we can afford to discount it when we discount these things. Instead of discounting, please just do special promotions in your hospital that month. Do a lot of Facebook posts, things like that. Maybe get an article in the newspaper, a radio talk show. Use social media, but please don't discount. When I went to practice, my first year in practice, that's what they were doing. And I'm like, well, I guess this is what we do. I went from February 1st to the end of March doing dentistry, and I about died. I'm like, this is ridiculous. Then I had a client come in October, and she had a grade 17 out of 4. Remember? 4 stages. This dog was like smelling the parking lot coming in. I had the owner on board to get her in to have her mouth cleaned up. And I said, I know we have an opening on Tuesday. Let's get her in. Let's get this done. And as soon as I walked away, I hear, if you wait till February, it's 10% off. I went back up front and I said, you know what? If you come in on Tuesday, I'll give you 10%. Now, I was the practice manager, so I could get away with that. But I had to have a come to Jesus meeting saying, this is an infection. We don't wait. And I still didn't realize how bad a problem this was until I went to my own doctor in January. And she goes, I got to get my dog's teeth cleaned next month. It's February. And I'm like, we do that 12 months a year. You don't have to wait till February. And in my head, I did say this in my head, and I know you can afford it, but I did not say that out loud. Okay. But do what you can. We know there's concerns. We have Dr. Google. We have anesthesia-free dentistry. We have cost concerns. We have people who are afraid it's too stressful for our pets. That mouth is more stressful to the pet than the procedure is. Make sure we promote it. We're going to advertise social media. I like, you can get little toothbrushes. I like them from Medical Arts Press. Individual, they're human brushes, but it's okay. Pediatric brushes with your clinic name and phone number in them. Give them away. I put them in puppy kits. I put them in, dental kits. Everybody gets a toothbrush. Sample packs, post dental cleanings. Give them packs of good dental treats. Things like that. I actually believed in TD so much, basically, because I did work on it for 7 years and did over 500 studies on TD that I know it works. We gave a 5-pound bag of TD with every dental cleaning if they could eat it. Yeah, we raised our price to cover it, but we gave that away. Doing dental report cards are huge. Make sure we start with prevention. Start early with that puppy or kitten. Maybe not the first puppy visit, but maybe the second or third. Start talking about teeth early so they hear about it all of the time and get the kids involved. Kids will remind their parents to do stuff all the time. Maybe put together a series of photos or videos of what it means to have your dental cleaning done at your hospital from drop off to discharge. Okay. And put it together because it's scary. They don't know what we're really going to do. They think we're just going to go back and brush those teeth. It's a little bit more than that. And I compare everything we do in our mouths to what we're going to do to the pet. So they have a little bit, from what happens in a human, except we don't need to be put to sleep to have our teeth cleaned. But we're going to go through that. We can create smile books with common before and after pictures and pathology. Back in my day, I had to glue them into a 3-ring binder, but now you can do like Shutterfly and places like that. But you have creative people in your hospital. Give them the opportunity to do this for you. Make sure we're doing relationship-centered care. And that means we have a conversation with the pet owner instead of data dumping. I'm going to ask them, what do they know about having their pet's teeth cleaned? I'm going to let them dump. They may or may not have right information. They may say, oh, I've never done this before, or I feed them coconut oil so we don't have to clean their teeth, or whatever the thing might be. But then what I'm going to do is, oops, sorry, I'm going to tell them and say, hey, I understand. And by the way, you always want to validate, no matter what they say. You're going to say, I understand your concerns about anesthesia. I understand you think coconut oil is doing what you think it does, but let me tell you what we do here at our hospital and what we're going to do to make your pet's mouth healthier. Then we give them all the information. But if you don't validate, they're not going to listen to you. So always validate their concerns. And then this is a little tough, but I will have them come back and kind of tell me what they understood from what I've said. Okay. Because when I do that, I have engaged them in a conversation, I've educated them, and now I've empowered them. Because we talked about the team members earlier, right? We had the veterinarian, we had the technician, the assistant, we've had the CSR, but we always forget about the fifth person in that mix, and that's the client. If the pet owner's not on board, we don't have the team that we need to do the best thing for their pet. Scheduling, like I said earlier, no more than 2 to 4 procedures a day. Base that on the evaluation for the mouth so that you can, and my doctors would come back and say, hey, it's a stage 2. We schedule it as a stage 3 because you're always going to find something. Okay. And we always gave them a stage 3 treatment plan as well. But you want quality over quantity. Treatment plans, I do an entire talk on this. In fact, I did it at Pac Vet on creating and presenting treatment plans, but sit down beside them. Don't just hand them a piece of paper and say, here's your treatment plan. Go through it. And what I do is I actually go through each thing. Why do we need to do this? Why do I need blood work? Why do I need? But I kept my hand over the bottom number. Okay. So that they're not freaking out by that. And then at the end, I show that. And that really, they're going, oh, that wasn't as bad as I thought it was going to be. So, a little trick to presenting them, but always sit beside them. Don't stand over the top of them, lean across the table, sit with them, be one-on-one with them. So it's kind of a psychological thing to be there with them. Like I said, I had the steps to the procedure in different places. That video would help, but also have them on your website because people don't always know what that means, what we're doing. It's more than just brushing the teeth. Okay. I have this chart. If you ever want it, you can get this. This is something you can create your own version of it, but people are going to go shop around, right? They're going to do that. And what it does is it tells us what we do at our hospital over here. And then if they're going to shop around, they need to make sure hospital B is also doing this. And then on the inside, why every one of those things is important. And you can reach out to me and I'm happy to send this off to you as a PDF and you can make your own version of it. This was made back in the day on Publisher, so it was a 3-ring, like a trifold brochure. But it really did help our pet owners understand. You can put it on your website too, to let them know what you do so that if they're going to compare, they're comparing apples to apples. Make sure whoever admits your patient to the hospital, I prefer a technician to do that over a CSR. I want to make sure we're getting informed consent. We have a signed treatment plan. If there's any additional procedures, we know how doctors like to throw that lump removal into a dental procedure. Where it is, what we're doing, if they've had meds, when were they last taken, were they fasted, and always get a phone number to reach that pet owner. Yeah, they're never going to answer, but get the phone number. Okay. We actually had a thing on our drop-off form that said, if we cannot reach you, we will do what is in the best interest of your pet. And we had them initial that so that we could do what we needed to. If we found something, we call the pet owner immediately. Okay. And it should be whoever is doing the procedure, technician or doctor involved, not an assistant, not a CSR, because they're not going to be able to give the information we need to have to get permission to do the treatment we need to have done. So try to make sure that we get that information. Also, make sure whoever's phone number it is has permission to make a decision. I was in a hospital who was getting sued because the nanny dropped the dog off and left her number. They needed to do something. She said, sure, go ahead. And this dog was owned by a dentist. Yeah, worst people in the world to have in veterinary medicine, dentists and hygienists. So, yeah. Anyway, so make sure we take the time to call. Also, this is a really fun thing that a friend of mine gave me. They take a picture of the dog in recovery. Now, make sure they're sternal. and drunk. They can be drunk, but they clean them up a little bit. Um, Potentially extubated unless they're a bulldog, then they're going to keep that tube till they walk out the door. But send it and text it or email it to the pet owner and saying, "Hey, mom, my procedure's done. I can't wait to see you." People love that. Okay. Now, this is obviously not a dog who had anesthesia, but that's the first day I got my dog, and she's looking at me like, "Are you my new mommy?" Yeah, we decided we keep her. I also have a different discharge form for pet owners or for dentistry than I do for other procedures because it is a different procedure. Okay. So this is mine. Again, it was created on Publisher, but I'm creating new ones for my website that'll be available soon for download. But make it short and sweet. People do not read anymore. Okay. Short, sweet, what to eat, what medications to take, when to start them again, when their follow-up visit is. Don't worry if they don't poop. Hate to have that, but you have to have it on there. What to watch for. But before and after pictures are huge, people. They just can never understand that that was actually what their dog looked like beforehand because they've never licked that lip. Okay. But before and after pictures are a huge, I even did it to my own son. He's going, "Oh my God, I had no idea my dog's mouth was that bad." I said, "Hun, that's the first grade zero I have cleaned in 2 years. She had stain, but she was grade zero, so even somebody who grew up with this thought it was terrible. And then I have a diagram here of the mouth where I can make notations. Maybe we took out a tooth. I can put an X through it because they're going to be afraid to look. I said, the left side, was it the right side? Was it up or down? And they can refer right to here. And then on the back, of course, I had some open space, so, I had to fill it. So I answered some frequently asked questions, and then the 12 steps of what a dental cleaning was in our hospital. Even though it was after the fact, they then knew what they paid for. Forward booking, if you're not doing that, that's a huge thing to get involved in. We've missed the boat on that. Veterinary medicine or ophthalmologists and dentists have done it for years. People will more than likely keep the next appointment if it's pre-booked. Don't say, just go look at your schedule and call me back because they're never going to call you back. Get it on the books and let them know that if it doesn't work, they can change it. Okay, but they're more than likely going to keep that appointment. It could be for the follow-up. It could be for the next year's cleaning. Okay. And by the way, I want to just run back here real quick on this. This is a technician appointment. Okay. The discharge appointment, I scheduled that at drop-off with the technician to go through everything, preferably the technician who did the procedure. I look at radiographs. We go through everything with the patient, with the owner, without the patient present. I bring the patient up when we're done. So make sure we realize that. I forgot to mention that. Make sure we're still communicating with our clients. Yeah, get rid of snail mail, but email, text messages. I probably get 5 text messages or 5 emails a week from my veterinary hospital, reminding me or telling me something fun they're doing. A courteous reminder for the next follow-up is a great way to do that. We want to make sure we're doing that follow-up appointment, even if I did not there was no extractions done. I want to see how that pet is doing a week or 2 weeks after, because maybe what I talked about for home care isn't working for that pet. Okay. And I can give them other options. So it's a great time to do that. All right. Have all these different, I'm going to eventually get these done. I swear I've been talking about it for 3 years, but I will eventually have these available for download on my website. Different information about all these different problems we see in the oral cavity. And then label claims, just real quick. Label claims are there to sell a product, guys. Okay. There is no control over what is on most products. If I go through the dental section of a pet store, I break out in hives because everything there is going to cause fracture, foreign body, yeah, all kinds of issues. So make sure you're looking at label claims. Look for the VOHC seal of acceptance. The VOHC org is there. All of these products have met a bare minimum of at least 20% reduction. I was just having a conversation the other day that I wish we'd put the percent reduction on it because there's products that are much better than others. And if you ever want to know, don't hesitate to reach out to me. I will give you the skinny on most products and what I like and what I recommend more than anything else because some of them barely made that 20%. So basically, when it comes to dentistry, promote, advise, educate, and prescribe. Okay. So there's my information. I will put my email in the chat here because
I put your email and your website in the chat.
okay, there you go. And there's Gypsy saying thank you for coming. Do we have any questions?
I had more of a statement, but what are your thoughts? I don't remember where it was. It was a few years ago. I was at somewhere, a conference, and the speaker was talking about using the term oral surgery
Hmm.
instead of dental because the dental word is such a weird word.
Well, dental
What are
is
your
oral
thoughts on that?
surgery. Oral surgery would be extractions.
Okay. So if
Okay.
we know there may be extractions, then it would be okay to use that term.
You could use it then, but you could say professional dental procedure,
Yeah.
something to that effect.
Procedure too.
But yeah, trying to get rid of the term dental. But if you say surgery, unless you're actually cutting, it's a misnomer, I think, in some ways. So,
Gotcha.
but yeah. And the fact is, guys, I mean, I know techs in a certain state that are actually cutting bone and cutting flap. And when you remove bone and cutting a flap and cutting a section in tooth, you're now doing orthopedic surgery. You're not doing an extraction is oops, it comes out. Okay. Yeah. Have I ever done those? Yeah. Halftime intubating a patient. Oops, that tooth came out. Put it back in for the x-rays. I'm just kidding. But, it is something that we have to make sure we're being appropriate about it. Um,
Thank you.
and that's true. The vets don't have a lot of training of oral surgery, but neither do technicians. Okay, send your vets to, you cannot throw a stick without having a weekend in this country that has an extraction lab somewhere in this country.
Yeah.
Every major conference has them. The Oquendo Center in Vegas has them at least once a month, I think. Everybody is doing them. So we are there to teach these veterinarians how to do it appropriately. Plus, there's some good videos.
There's one. I
Um,
know we have Dr. Nemec in Southern California.
yeah, I know
It
he
does a
teaches
lot.
technicians, and he and I just taught together on last Monday, and we were about that. I'm like, stop teaching. And that's just me. I've known Brooke since before he was Brooke, so I can make fun of him if I need to.
Yeah.
Wellness plans. Yeah, I mean, have those patients in there, but make sure you're doing that at the right level with the wellness plans so that we're getting that patient not just superficial. They have to clean below the gum line, and they can do it. One of the things I will tell you is make sure your team gets real training on how to clean, because too many people use a universal tip, which is absolutely worthless. Use the beaver tail on the crowns and a periodontal tip below the gum line. It speeds it up a lot. Um, yeah, staff training, great way to do it, and plus it gives them a really great idea to, they can be now that poster child because now I believe in this teeth cleaning because my dog is better.
Yes, there are.
So
You
anyway,
mentioned the time frame earlier when you were talking about the different stages, like
mhm,
not scheduling too many in a day. So what
yep.
do you think? Because I have a hospital that the owner's not sure if the technician's taking too long to do the dentals, and I'm not the person to ask, obviously. So what is a reasonable amount of time would you categorize? Like you kind of told us, like
Well, I don't
very,
like to give ever a time frame because
okay,
like when I say like with x-rays, people will say, how long should it take? I said, well, it takes as long as it takes. The more you do, the faster you're going to get. But if I gave you what I can take a set of x-rays in, I don't want a doctor going back and saying, well, you can do this in X number of minutes. Why can't you? And I'm like, because they don't have the training. It should, I like to say an hour for a grade one, and that's everything from intubation to wake up. In that is if you're using the right tips and the right spots on the mouth, on the right part of the teeth, and some other little tips and tricks I do during my COHAT training, it actually speeds everything up. So one time I was asked to go into a hospital to find out why their technician was taking so long to do dental cleanings. And I watched her and went back to the practice management consultant, who's a really good friend of mine. And I said, well, here's the deal. If I had a practice, I would offer her $10 more an hour than you're paying her right now. She is that good, but she's doing everything. She was monitoring anesthesia as well as cleaning, so she had to stop every 5 minutes to take a full set of vitals. That added 35 minutes to that dental procedure. I said, if you had somebody else doing that for her, she'd be in and out in rocket time. So we have to make sure that people understand that we have to do it right. This is a no longer a elective procedure, is what I'm trying to say, where it's just not important. Brittany asked about staging cohats. Yeah, you can stage a cohat. I'm always kind of hesitant about doing that. That means that we're going to do some of it now and bring them back in 2 to 3 weeks to do the other part. That really depends on what we're doing. I know there's some dentists who love it, but the vet dentist clients are very dedicated because they're already going to a specialist. In a general hospital, that may not be the case. I probably would not recommend staging if I think this is the only chance I'm going to get to see that patient. If I really feel they're a client who would come back in and do what I need to do the second time around, yeah, then I'll stage it. But for the most part, it's like, yeah, I'm going to try to get everything I can done in the time frame I have. So it just really depends. But I always have to tell the dips when they tell me that is like, well, you know, your clients are already at a higher level than the majority of the world is, and we have to keep that in mind. So sometimes I have to. I love my dips, but sometimes you got to take them down a notch. You know, like calm down. Not everybody is you. Okay. So, but any other questions, you can feel free to reach out to me, guys. I'm willing to help. If you want any of those things that I talked about, let me know. I am jumping in a car as soon as I'm done here to head to Southern Missouri for a training. So it may not be till Monday till I get it to you. But don't hesitate to reach out with any questions or concerns you have.
And if they
Okay.
wanted to have you come to their hospital and
Yes.
do the training,
Yeah.
like,
Oh, by the way, yeah, I do that. I'm sorry.
yes, I
Thank you
wanted to
for the
make sure you
plug
got
there,
a chance
Melissa.
to share about that. That's what she does.
My real gig is to I go and I have 10 hours of race approved CE for doctors and technicians, and it will include 4 hours of radiology training, positioning. It'll be a 4 hour one called I call the complete plan for the perio patient, and it's about 3 hours of lecture, kind of what I just did on the gaining compliance. So for the whole team, and then I special or get into review of anatomy and charting, um, common pathology and steps to the COHAT, and then a demonstration of doing all of that on a specimen, and then a 2 hour nerve block, which is an hour lecture, an hour hands-on nerve block training for doctors and technicians. It can be 10 hours in one day, which I do a lot, or it can be broken up into 2 days, like a morning and an afternoon or whatever. But I do schedule those out. I'm like looking into almost the end of February right now. But I travel all over the country doing those things. So, you know, helping out practices really take everything up a notch. Because like I said, most of them don't get training in school, or we have OJT techs that have not had any education. We want to make sure they're, you know, what was taught, what was done 20 years ago by that person that trained them may not be what we want them to do now. So we want to make sure we're getting them the right information they can. And we give them all kinds of resources to make sure that they have it. And then the other thing is I also have a textbook available. You can't see it now. Boy, I hate doing that blur thing, but it is Companion Animal Dentistry for veterinary technicians. It's on Amazon. Um, Even though it's for technicians, I guarantee I have many, many doctors who tell me how much they love the book. It'll go through almost everything they have to do. I'm in the process of trying to get my publisher to rewrite or let me do a new edition. Because all the names in veterinary medicine, they change the names of our diseases every 5 years just to keep us on our toes. But so far I'm struggling getting them to do that. I may have to buy my rights back and take it somewhere else. But it is available on Amazon for it's like 87 bucks. So it's a great textbook, over 200 and some pictures. So, but yeah, let me know if there's anything I can do to help you guys. And I think I just
So there's two more
pricing.
questions.
All you have to do for pricing for me is just send me an email. Right now, the 4 hours, each of the 4 hours is $1,500. The two is half of that. And then plus expenses, depending on where I have to go. So yeah. And you
And will
can't, I
they,
always tell people you cannot send your entire team to a wet lab at a conference for what it costs me to come in, and your whole team is hearing the message.
that's all.
So yeah, because most wet labs are about $400 now or 500. So
Yeah, they're definitely not cheap. Are
mhm.
you going to be able to send me a copy of a PDF of your slides? Or did you
I
already
can
do that thing?
probably do that. I usually don't share them, but I can do that.
Oh, that's if you can, it's okay. Just
Yeah.
someone was
No,
asking.
and I do not train on extractions because as a technician, that is not my purview.
Okay.
That is a doctor's role, not a technician. I know California. Don't get me started, but I
I
can't.
know. Sorry, that's where I
Yeah.
am.
Yeah, I know. I know. I'm just saying. Yeah. I can train a doctor on extractions. I just can't let them never know that I did that. But
Well,
yeah.
Thank you so much, Mary. I really,
All
really,
right.
really appreciate you coming on today and giving us all this information. It was excellent. I will upload it to my YouTube channel. Probably not for the next few days because I got a crazy schedule. And I was thinking if she isn't able to send me the slides, you guys can
I
take a
will,
picture of. Oh,
yeah,
you
I'll
can.
send them
Okay.
to you
Thank
when
you
I'm
so much. I
done here.
appreciate
So
that.
yeah,
I'm only going to send it to the people who attended it live. So
yeah, yeah, that's fine.
excellent.
Yeah, just yeah.
Which I'm a little confused about the Hauser. If you can send me your full name, because I don't know who you are, actually. Uh, so anyway,
Okay,
thank you
yeah,
guys
I
for
know.
coming. I'm going to go ahead and stop.